become considerably less desirable and more expensive and difficult to remedy. Now, let's say you already have a long span bridge replacing 4 or more teeth, and you have just found out that you have decay under one of those crowns. And it's not just a little decay, but it's gotten so far out of hand that it's gone well under the bone level. Your dentist has told you that the tooth has got to be removed. Now you have 5 or more teeth that need to be replaced. You probably have root canals on those teeth behind, and they will not be able to support a long span bridge. Previously, your only option was removable teeth or removable teeth. But now, with modern surgical and dental procedures, you can have permanent teeth again, and with implants, and they can last as long or longer than your natural teeth. Depending on how many teeth need to be replaced and where they are located in your mouth, it is recommended that if you are missing 3 teeth, you will need 2 implants. If you need to replace 4 teeth, you will most likely need 3 implants. If you are missing 5 or 6 teeth, well, this is where it gets complicated, and we need to talk about the specifics, your specific needs and desires. We also need to evaluate the bone quality and the rest of your oral hygiene. Now, let's say you have no teeth, or you have lost enough bone around your remaining teeth that they will no longer support a bridge or removable teeth. Your dentist has recommended, or you have decided on your own, that you should have all of your teeth removed. You have heard that an upper denture fits well, but you lose your sense of taste because the plastic that covers over the roof of your mouth. You have also heard that the lower denture usually does not fit well. Well, if you're getting extractions and you're getting your first set of false teeth, and you have a good dentist, these plates should last you for a good while. And you may not feel the need for implants. But no, over time the upper jaw will shrink back and up, and the lower jaw will shrink down and forward, creating a significant mismatch. And the denture that starts out fitting good will not always fit that way. That's because your bone shrinks and the plates become loose. So just because you get new teeth, you cannot stop seeing your dentist. You need to continue to see them regularly, as your dentures need to be relined and your gums need to be checked to make sure there are no lesions or tumors that need to be biopsied. Now, once you have had your dentures for a while, they can no longer successfully be relined, you will experience a change in your diet. This happens slowly, as the bone shrinkage happens over years. One day you will notice you can no longer chew steak or eat an apple, or your teeth click when you talk. With the change in your diet, there's also a change in your nutritional status. The problem is that you start eating foods that cause insulin swings and cravings to eat more foods high in carbohydrates, because they are the only easy foods for you to eat. This, of course, causes a whole new cluster of health-related problems. So, in order to get yourself in a more healthy status, you should anchor your teeth more securely so you can eat healthier foods. Often it only requires 2 implants in the lower to completely secure the lower denture. You would be amazed at the difference and the freedom this gives you. If you are tired of not being able to taste your food because of the upper denture, 4 or 5 implants will allow you to get rid of the plastic on the roof of your mouth. If you just want to make that upper denture more secure, then 2 implants may be all you'll need. But if you don't want to take the teeth in and out, and if we believe you will be a good candidate at cleaning around the implants, you will need anywhere from 6 to 8 implants. Obviously, this is getting more complicated, and that is why we need to discuss the specifics with you during a private consultation. Now, what I have discussed so far are straightforward cases that involve no bone infections from root canals or fractures. If we are removing teeth that are currently infected, then we need to discuss how this infection will be cleared before placing the implant. In most cases, removing the source of the infection will allow the infection to go away. If you have a failed root canal, we need to discuss the quantity or the amount of bone and the quality of the bone. We may need to do a bone graft in that area, and that is importing bone and allow it to fuse with the existing bone before we place the implant. This has become a more common procedure, as we are very aware that the implant needs to be placed in a position so the stresses go along the vertical axis of the implant. The days of placing implant where the existing bone was and having your dentist trying to work their magic is over. You may be wondering also, can we place the implant and the bone at the same time? The answer to this is becoming yes more than no, but this will be addressed in your private consult. Today's sophisticated technology allows us to safely and predictably place bone where it is needed, then place the implant in its ideal position. This is far more likely to lead to a long-term stable result, meaning if a tooth goes bad, it will most likely not be the one with the implant on it. Please feel free to review my entire website for more information on implants. We know that the key to making the right decision for you is working with all the information. An informed patient is the best patient of all. I love it when you come to your private consultation with lots of questions. Thank you for your time.